I'm a dance teacher. Been teaching since I was about 16 years old.
Well, Janet Streens was in her mid-60s. She is a dance instructor for young people of all ages. And she has to use her arms for ballet, jazz, and everything else. And when she came to me, she had rotator cuff tears on both shoulders, but one was worse than the other. So the traditional management is to repair the rotator cuff, which I did. It didn't heal. So now we were stuck with the option, can she live with it and just go on with her life, or is there something else that could be done?
It hurt when I danced, and I'd come home and cry in the shower, tears, and wail. It hurt so bad. You have two choices. You can remain like this because we can't do any more rotator cuff surgeries. It's not going to stay. It's just not going to work. So you either can just be sort of non-functional and live your life the best you can, or you can have this reverse shoulder joint.
It gets its name for the fact that it reversed the ball and socket, but it also changed the way the shoulder actually moves so that it essentially you don't need a normal functioning rotator cuff to make it work. On her 6-week visit, I said, Janet, why don't you go ahead and raise up your arm? And Janet's a dancer. Instead of just raising her arm like anybody, Janet did a movement like a ballet dancer.
I could never do a ballet port bras.
She did that right out of her sling at 6 weeks, and if I remember correctly, it brought tears to her eyes because she hadn't been able to do that for a long time.
I feel so lucky to live in this time and to have a doctor as wonderful as Dr. Romeo. I would consider him, in my eyes, the best in the nation, if not the whole world.
For me, that's just one of the most gratifying aspects of what I do, is that I literally have changed a person's life at a time when they were at a crossroads where they had to decide, am I just going to have to live with this for the rest of my life and give up all the things that have been important to me for 50 years or more, or is there something else? And for her there was, and it's worked out great.